Hi guys, so welcome back to my YouTube channel. We'll continue with analysis of the optional paper, and today I'll be discussing medical science paper 2 of UPSC CSE 2025. Before starting this, I'd like to mention in 2024 my score in medical science paper 2 was 137, right? So let's see how the paper was this year. This is the compulsory question of section A. Describe the role of lifestyle interventions in prevention of coronary artery disease. A very generic question, because this question can also be a question of PSM. This is not a hardcore medicine question. You can of course talk about balanced diet, about exercise, about various other measures which can be taken, but this is a very average question, very difficult to make an edge in this question. Second question, describe the role of various imaging modalities in pyelonephritis. The main is CT scan. You can mention about the micturating cystoarthrogram. But once again, not very easy, not very tough, but okay, somewhat manageable question. So medicine 20 marks is manageable only. What was very different was that there was no psych, which is very strange, because if I remember correctly, if one looks at the previous 5-6 years PYQs, there is a question of psychiatry always, and if not in the compulsory section, psychiatry somewhere was always seen in the paper. So this time it wasn't asked, breaking away from convention, making our lives more tougher, because both the questions are very generic and you never know the absolute correct answer for both of the questions, but you can easily score a 5 or a 5 in both the questions. Coming to pediatrics, ARI was asked, which is a program by WHO. What we study is IMNCI grading. It is somewhat similar to ARI, but not exactly similar. So using that knowledge, because they have asked exactly right the treatment of different types of pneumonia, so that's for 4 marks, criteria 6 marks, still somebody can score a 5, 3 plus 2. If you have a basic idea of IMNCI, you'll be able to get there. Fourth question, how will you treat hypothermia in a 3-year-old child with SAM or severe acute malnutrition? How will you prevent? This is very strange question. This is given in our textbooks, but usually if you look at the questions previously which were asked, they are more macroscopic. For example, they'll ask you all the 10 steps in rehabilitation. This time in the question paper, they've asked very specific of those 10 steps, they've asked a single step, which makes the question difficult. Because we can answer in generic terms, even if you look at the textbook in OP Ghai, you will see it's just one paragraph, which is also very point wise and very generic points, very difficult to recall in the examination, a tough question. So pediatrics was on the tougher side, and even medicine was not very tough, but is very strange. So you can't score very high in this 40 marks worth of section. Coming back, joint family comprising of senior citizen, ANC, this is a PYQ. Now see, scabies was last year also asked in 2024 in the compulsory section as a 10 marker. This year also they've asked scabies, but last year the question was very easy because they'd asked about the distribution of lesions. This time they've asked very pinpoint question, organism, factors, plan. So the plan will vary for each age group, which drugs to avoid, benzene hexachloride, etc. Can be tackled. DMAT as always is the easier section of section A, but let's see what mischief they've done this year in this section. So looking at question number 1, a 25 plus can be scored, but not a very 30 plus, because why? The questions are very generic, and at the same time some are very specific but have generic points. This question, there is no question in this world in medicine paper which is without diabetes. Just as kidney is the king in pathology, diabetes is the king in medicine. So it's simply DKD, diabetic ketoacidosis. You can mention everything about this. This is a 12 plus question, because there's nothing much in this question, right? The only challenge, once again, as I've mentioned, I hope everybody takes note. This is very, very important, because okay, you only have 4 pages, but the question is printed here, so you will in effect get only 3.75 pages. So please manage your space properly, because sometimes what we do, we draw flowcharts and that takes up one complete page. But in this question, you have to write a stepwise approach. So that is the only challenge. Space management is the only challenge in this part. And I, by the way, also attempted this question. So define acute diarrhea. This is actually 5 into 4. There are 4 subparts of 5 mark each. Definition of diarrhea, okay, for 2 marks, and its causes, this is for 5. Can be tackled. How will you assess for dehydration? Assessment is also, we're learning about is in IMNCI. It's also a separate mention. Management of diarrhea, management of pneumonia in the syllabus. This nutritional management of acute diarrhea and steps taken for prevention. This part was easy. So 15 marks question, very easy, 8, 9, but this part, nutritional management, I only remembered zinc, and you have to start feed what all you have to give. But if you open OP Ghai's textbook, there you will see proper mentioned है 1 2 3 करके nutritional management of diarrhea के steps. So this was directly a question from OP Ghai. So because of this sub part, it will bring down the average for me for this 20 marker. I won't be able to score very high, like let's say a 13 or a 14, but somewhere around a 10 or a 11 is fairly achievable. Once again, DMAT. Now see the challenge which I was talking about. This is a 10 marker. This ideally should have 2 pages, but this had 3 pages. Okay, one might say that okay, because you have this also subparts, but very difficult to fill these pages. Before attempting the optional paper, before writing any question, my only take home message is please look at how many pages have been provided, because the general wisdom says that don't cancel out any page. So before writing this answer, what happened was that I tried to squeeze both these in a single page, and then I saw there was also given another page. Thankfully, I saw this while writing this part itself, so I was able to write this on the 3rd page and these in these 2 pages. Space management is very important. But okay, this is also a generic question. Define eczema. How will you classify eczema? Various classification and differences. This is also a PYQ. DMAT as usual, predictable, very scoring, but as you see, only a 10 marker here and only a 10 marker here. They have eliminated 15 marker from DMAT. So at max, you can only attempt 30 marks worth of DMAT, which earlier you could attempt 40 marks worth of DMAT. So that's a hit. Now this question. Elaborate the indications for initiating antiviral therapy. Hepatitis was expected. It hadn't been asked. It is a part of the syllabus. But if you look at this, oh my god, 10 plus 15. And once again, this is a 25 marker, but we only had 4 pages. Can you imagine? Here for a 10 marker, they had given us 3 pages. Here for a 25 marker, they are giving us 4 pages. I don't know what's wrong with the commission, why they are setting the optional paper in this manner, but this needs to be looked into. Elaborate indications for initiating antiviral therapy. There's a proper American Association guideline. But if you look at this, write first line antiviral treatment for management of chronic hepatitis B along with the recommended monitoring strategy. I only knew very generic points in this question. Like there's a proper guideline, but वो आपका सिर्फ 1 पेज का काम है. उसके बाद आप बाकी एक्स्ट्रा क्या लिख सकते हो, very difficult. So because of this, had this been a normal 15 marker, this would have been an easy question. Now since it's become a 25 marker, how this question will be marked, how exactly, what exactly are they expecting, what exact guidelines do they expect, we don't know. So this is a very, I have attempted this question, I'll clarify, but I'm not very certain regarding this attempt. I'll be even happy with a 10 out of 25, very happy, because I think somewhere while writing this question, because I attempted this part in the end, so I have somewhat messed it up. Right, risk factors. This is a very easy question. A PYQ, whatever you like to say. In pediatrics, we study everywhere this, but this is a 15 marker. They had only given us 2 pages. Imagine squeezing, and this section question, imagine squeezing this much of content worth 15 marks, but they've asked risk factors, differential diagnosis, management in 2 pages. Had they given 1 more page, I would have been certain that I would have scored 11 or 12. But I think a 10 or to 12 is a realistic aim. Psoriasis, this is impetigo herpetiformis, pustular psoriasis of pregnancy. You can diagnose it, management. Now, this was very confusing because this is the only condition in which steroids are to be given. What I have mentioned is you don't give retinoids because there are teratogenic drugs. No to methotrexate, teratogenic. Complications, okay, you can mention, but I wasn't very happy with my attempt. I'll say 5. So in this question, a 5, 10 to 12, let's suppose 25. with a maximum of 10, but I'll somewhere score between 20 to 25. That's what I believe. Coming to the fourth part. Now, what is up with leukemia? I don't know. But leukemia has become something because earlier in the previous papers, people were somewhat giving it a skip. So the commission has now understood. It's one of the most commonly unasked topic. We were also expecting blood disorders such as hemophilia, but that was not asked. Once again, what was asked was leukemias. They have asked how will you differentiate on a peripheral smear and bone marrow finding. This should be linked with pathology. If there's any topic which needs to be done, it's pathology. Male leukemia. Why? Because leukemia was something which was there in paper 1 also. It was also in paper 1 last year. It was also in paper 2. And if you look, it was once again at 25 markers. So if you realistically look at this paper, if somebody has just read hepatitis and leukemia, they can solve 50 marks of paper. That is a huge say. So in contrast to paper 1, where UPSC was going for this 5 plus 5 plus 5 to ask maximum content, they have done just the reverse in paper 2, wherein they are asking 25 marker from a single topic. Instead of focusing on very wide range of topics, they have narrowed it down specifically. I, of course, did not attempt this question because I have attempted the previous 3 questions from this section. Now, national immunization schedule in children events. Okay, easy question linked with PSM. Was somewhat expected. Even compared to last year in 2024, they had asked about pneumococcus, if I remember correctly. So vaccine they are somewhat trying to ask a question on vaccine every year in pediatrics. Can be managed. Now there is no dermat once again in this subpart. So this has 35 marks worth of medicine and only 15 marks worth of pediatrics. So pediatrics ka share somewhat has remained the same because at 15 and 20. So if you want, you can still attempt 20, at least 55 marks of pediatrics. But dermat, of course, maximum one can attempt is 30 marks worth of dermat. And if minimum, then only 20 marks of dermat. Diagnostic approaches to renovascular hypertension, part of syllabus. Easy question, but only 10 marker and diagnostic approach puchi hai. So they are expecting some sort of flowchart, etc. So with this, we end with part A or section A of paper 2. In the next video, we'll move on to section B and do a thorough analysis of how the paper was, how tough and easy it felt compared to previous years. So thank you for watching. I'll see you in the next video.